Live from Wave in Louisville, Kentucky. This is Listens Live.
Hello, everyone. Good afternoon to you, and thanks for joining us here on Wave Listens Live. I'm your host, Brian Schlonsky. We've got a fantastic show on tap for you here on this Tuesday as we take you to the rundown now and show you what to expect here on Listens Live. We've got Kentuckiana Crime Stoppers back with a fresh list of wanted fugitives. Your anonymous tip could even lead to some cash in your pocket. We also have First Hour Grief Response here. They will talk all about the Angel Walk that is coming up this weekend, so we'll make sure to fill you in on those details. But up first here today, we have Advanced ENT and Allergy. We are going to discuss the new walk-in clinic, and I've got a couple folks here to help us do just that as we bring you back here into our studio and introduce you to Kaela Orwick, who's on the end, a nurse practitioner, and Robert Foster, Director of Operations. Welcome both of you to Listens.
Thank you for having us.
Let's start with you, Robert, because I think it's pretty nice to have an option like this out there for patients, a walk-in clinic. How did it come to be? Why did you guys say we need this in our community?
That's a great question. You know, the biggest thing that we looked at from the community standpoint was we're a busy practice, and as part of that, you know, having 6 to 8 weeks in between patient visits is not really conducive to patients who need to be seen on a regular basis. So we looked at the community and said, let's hire somebody dedicated just for the walk-in clinic. Let's put this at 3 of our large locations and let's staff it every day.
Let's talk about those locations, because being that you are as busy as you are, I know that a lot of folks say, hey, could be a great option for me, depending on where it would be.
Yeah, absolutely. So right now, primarily our walk-in clinic is open 5 days a week. Mondays at our Gagel location off Dixie Highway, Tuesday at New Albany, Wednesday and Thursday at Breckenridge, and then we round out the week with New Albany on Friday. Okay,
perfect. Well, it's good to know not only where these locations are, but also some of the issues that some of the walk-ins will be taking. So, Kaela, I'll turn to you for this question. Any conditions in particular that you would be looking to treat there?
We look to treat acute, like sinus infections. We treat ear infections, things that you could typically go to urgent care for, but may do better if served if we can get ahead of it and treat it for you. So
when we talk about some of the issues you brought up, like ear infections, sinus problems, anything like that, what are we looking at on the patient side of how long it takes to get seen and treated, and kind of what comes next down the line?
So same day. So and they can just walk in. If they don't have to call ahead, they don't have to make an appointment. There may be a little bit of wait just because we know how many people are there already, but ideally they would be seen that day in a very timely manner.
From your perspective and doing the type of work that you do, you saw also there's a big need for this. You think it's gonna help a lot of people?
I do. We first started off, it was a little slow, but I mean, just now in the few weeks we've been doing this, we've seen I think a very increase in the volume of our patients that we're actually getting the help. So.
Robert, I want to talk to you about some of the other treatments and procedures available, because Advanced ENT and Allergy able to help folks in a variety of different ways. I know that there are maybe nosebleeds, earwax removal. Are these services that also would be seen at the walk-ins, or is this something that we need to book appointments for?
No, I mean, we can definitely always try to see you for those type of things automatically. Our goal is not to send anybody away, especially if we have the ability to treat, him or her, that patient. So we're going to try to see you. Kaela will do her best, and then if not, we have plenty of other board certified physicians that will be able to help get that patient in as soon as possible.
I know, so you mentioned it there a couple times, as soon as possible, same day. It's all about walk-ins, all about the speed. So Kaela, for you, as you go through and treat people, is there anything, if I know I'm going to be a walk-in patient, that I can do on my side to make this process even more streamlined, make it even easier, and be ready to go when I come down to the clinic?
That's it. Not so much. I mean, just when you come in, give the desk the information that what you want to be seen for, so that way when you come back, we kind of have what we're going to deal with. But really, no. I mean, we're kind of prepared to see whatever it is when it comes through the door.
That's good to know. So we don't have to do anything on our end before we walk in there. It's making it as easy as possible on us. Let's talk for a second, Robert, with you about the insurance payment options, things like that. Any restrictions or things we need to know about there?
So no general restrictions. Primarily, Advance has done a great job of being partnered with most, if not all, local payers. I can't speak for every patient. There's always the one-off scenario of something we don't necessarily contract with, but we are more than willing to work with any patient for any type of off-the-wall payment plan, something that comes up that they can't necessarily afford. We're here to help them with that.
Let's stay with you for a second because I want to talk a bit, go back a bit in case any of our viewers, you guys have been on with us, Advanced ENT and Allergy before, but if anybody watching today hasn't gotten a chance to hear about the company in general, some of the things you'd want people to know.
Sure. So it is ENT and Allergy, specifically for a reason. Of course, anybody who lives in Kentuckiana knows that there's no just peak allergy season. It's pretty much all year long. So we treat allergies with injectable immunotherapy as well as sublingual drops. So if you're afraid of getting a shot, we definitely have some treatment options that are available for you. And then from the ENT perspective, we have 14 very dedicated and tenured physicians who treat a wide variety of things from thyroid to facial plastics and some different things that we have available. So a large gamut of options available for us.
We have talked about this in the past, but it's always good to do a refresher, Kaela. Even especially now in the fall, we see allergies seem to uptick in this area. Are there things that we can look at and realize, okay, I think this is an allergy suffering symptom instead of something that may be the common cold or a different type of respiratory infection?
Some of it can just be timing. Same time every year you're getting those issues, it may be more allergy related.
You know what's coming.
Yeah. And now if you've been hanging out with someone that's been ill, you may be more viral. But
sure.
Typically if it's kind of got a pattern to it and those symptoms correlate with that time of season, it's probably more allergy related.
For you, what has been the most rewarding part of doing your job, being able to help people here in our community?
Sometimes it's just simple fixes. People come in for their ears have been clogged up and you take out some wax and it changes their world. They're like, I can hear again and I feel better, and to us it's quick and simple, but to them it's a big deal, and little things like that, just getting to help them been really nice.
Helping their quality of life.
Yeah,
and like you said,
they can't do for themselves, so we do it for them, and it's been nice.
That's actually a good reminder too. You may even think that something is a bigger issue, so you've been putting it off and you've been nervous about it.
Yeah.
Get to come in, maybe even in a walk-in type situation,
Yeah.
have it handled right then and there.
Yes. Yeah.
Okay, well, we've got about a minute left. Last thing I want to ask you, Robert, is go over the information for one last time, where to make sure that we can find the walk-in locations, any numbers, websites, things like that we need to know.
Sure. So visit our website, advancedentandallergy.com, has all of our locations. You can even schedule an appointment online with any of our physicians. But from a walk-in clinic perspective, we are open 5 days a week at different locations, Monday being Gagel, Tuesday, New Albany, Wednesday and Thursday, Breckenridge, and then New Albany on Friday.
Well, I want to thank both of you for being on the show with us today, sharing this important information. And as a longtime allergy sufferer in the Kentucky region here, thank you for the work you do every day.
Thank you so much.
We need it. All right, stay with us here on Wave Listens Live. We've got 2 more great segments to go. Coming up next, we will sit down with Kentuckiana Crime Stoppers. There is a new fugitive most wanted list. We will bring it to you after this short break.
The Wave Charlie Wilson's Jen Air Kitchen is furnished by Miller's Fancy Bath and Kitchen, Kentuckiana Countertop.